Our body's not built to stand or sit in one sustained position for a long period of time. Welcome back to another episode from the Optimal Body Podcast. I'm Dr. Dom.
I'm DocJen.
And today we're going to be talking about coccydynia or tailbone pain, which a lot of people can get when you're sitting or standing. We're going to talk about the reasons why and what you can do about it. All right, so tailbone pain. Have you ever had tailbone pain?
No, luckily.
Me neither. And there can be a lot of different external or even internal factors that can result in tailbone pain. And before we dive in on all the nitty-gritty about that, please comment below. Are you somebody who has tailbone pain? Do you have specific questions about tailbone pain? Make sure you hit the subscribe and notification bell because we have so many more topics we've gone through in the past and that we'll be releasing in the future, and we want you to have access to all of them.
And you had something that we're going to talk about. You were sitting on something to help relieve your pressure.
I was using a Coregeous ball, which is one of our favorite all-purpose tools for tissue myofascial type release, for breath work, and now I guess we can add relieving tailbone pain or tailbone pressure to that list. But it just, when I was sitting in the car specifically, it helped lift my bottom and it helped me putting my pressure through both my sit bones and just in generally like my upper thighs and lower buttock, and then keep my tailbone off of the seat where I was having a lot of discomfort.
Which is one of the things they say to help.
Why do people get coccyx pain or coccydynia? Direct trauma? Like a lot of times gymnasts I know, or people ice skating or rollerblading, if you've ever just had your feet go out from under you, land on your buttock. That's 2 times using buttock in this episode so early on. Otherwise, direct pressure, like you said, just from sitting, especially if you sit kind of been slumped back with your pelvis tucked under and more of a posterior pelvic tilt, you're putting a lot of direct pressure on your tailbone, which is not where we should really put pressure while we're sitting. And then there are different internal factors.
Yeah. I mean, those who have a lot of hypermobility can be prone to getting a lot of increased pressure back into the tailbone area. If you have any childbirth trauma when you went through birthing during Pilates, so yoga, Pilates, things that are sitting or maybe putting a little bit more pressure, that could happen. And then if you have a suddenly rapid reduced weight loss, well, you just rapidly lost some adipose tissue within your buttocks as well. And so now when you're sitting or doing exercise, you might be putting a little more pressure than you're used to in that area.
The good news is 90% of people who have tailbone pain respond really well to conservative treatment and don't need anything beyond that, like injections or, there are surgeries even for tailbone pain.
Yeah. So if you have it not because of, you fell suddenly or recently, then we want to be looking at the other things that can help. And this is where pelvic floor physical therapy actually becomes really powerful as a tool to be able to help, because there are actually mobilizations that you can do to the coccyx bone, and it is a little bit more intimate with your therapist, but can really help in relieving that immediate pressure as we're working toward improving mobility around the area, movement, changing your posture, all that kind of stuff. Joint mobilization, you have to use a provider. Massage and stretching, you don't have to use a provider. You can do that on your own, and we usually show this with different tools that we have. You can use a pelvic wand as well. You can use one of the therapy balls from Tune Up Fitness, to kind of get that into that pressure, and then you can do some specific stretches, but those can really help to take off that pressure from that tailbone area, and that was actually shown to be a greater effect than joint mobilization. So I think that's pretty cool.
In this podcast, we want to give you the tools that you can go and have actionable takeaways for yourself. The other study that talked about doing stretches, and they specifically looked at hip flexor stretches and also thoracic opening and piriformis stretches. And they actually found that doing stretches and exercises for these areas resulted in better posturing in sitting and standing positions, so they weren't putting as much pressure on the tailbone area.
Yeah, so more pain-free sitting. I mean, that's the goal, right? It ultimately is what someone wants to feel. So again, especially if we're looking at static stretches, they did this for 2 minutes on each side. So think of a hip flexor stretch, 2 minutes on each side, and they did that 5 times a week. So it has to be something long-term. It has to be sustained for a long period of time. They have to do it repetitively over and over again in order to start to see any kind of benefited result. But in doing that, they did see a result. That's really cool to just keep in mind. And this comes back to our own recommendations of assessing our posture. We have to look at the upper back and the thoracic spine, the rib cage, because how my rib cage is resting really is going to dictate where my pelvis is underneath it then. You know, it kind of just like plays off of one another. A lot of times when people do find themselves standing in a little bit more anterior pelvic tilt, well, let's look again at the rib cage. Typically, sometimes it's then flared and it's forward. And when we're trying to correct our posture and pull our shoulder blades back, but we're actually flaring that rib cage. So when we flare that rib cage, then the pelvis is going to respond by tipping forward as well. So we have to then say, okay, how can I get that better rib cage mobility out to the sides, which we talk about a lot. Grabbing the sides of your rib cage, doing some intentional breaths to kind of open it up and allow it. And when you do those intentional breaths into the side of your rib cage, you naturally start to stack over your pelvis. You're going to do this in standing. Do it in standing right now. I don't care where you are. I'm just kidding. When you get a chance, stand,
driving,
wrap your hands around your rib cage, do some really big breaths into the sides of your hands, and you're going to feel what happens on your pelvis. It's going to naturally stack underneath your rib cage.
You know, our body's not built to stand or sit in one sustained position for a long period of time. So the rib cage breath is incredible, because even if you come back to that once or twice an hour, if you're working and you can't move a ton, and you come back to that rib cage breath and you do some pelvic tilts, the next thing I was going to say is like the classic cat cow. Like get down on your hands and knees, do a cat cow. Get seated in your work chair, do a seated kind of cat cow or pelvic tilt. Stand, if you stand at a standing desk, do some pelvic tilts. And it just helps bring that awareness to, okay, how am I positioning myself? Find that pelvic neutral-ish. It's not super important that you stand in a perfectly stacked position, but if you bring that awareness, take one of the rib cage breaths, and then get back to work, you're going to be doing your brain and your pelvis and tailbone a massive help.
And when we just start to improve our thoracic or our upper spine mobility in general, it's going to help us to not be so slumped, put so much pressure. It's going to take pressure off of our pelvis as well, because we're going to automatically be standing up a little bit straighter. When we improve our hip mobility, it's going to take different pressure. So not only hip flexor, but in general, your entire hip mobility, you're from your glutes to your pelvic floor, to your rotation of the hips, your joints, like all of that. If we help to improve the way that that moves, it's just going to be resting in a state that feels a little bit more relaxed for your body and isn't putting as much strain and tension in different areas like your tailbone. So I think like all of those are so important.
Yeah, and we kind of mentioned already like the pelvic floor, how vital this is to the component. I realize we've been talking about this and I'm just like sitting here like a slob resting into my tailbone. My rib cage. Yeah. Okay. There's a gymnast sitting there with like the pelvic floor is like so vital because the levator ani and other muscles attach right into that tailbone. So if we're not breathing effectively, if we're always holding tension in that pelvic floor, if we're not allowing it to just relax and then tighten with our breath throughout the day, again, we might be putting some unbalanced pressure there. So like you mentioned, doing some of the pelvic floor reset/releases or awareness exercises with like the tune-up fitness balls are an amazing place to start, because it brings that awareness. And then while you're doing some of these other exercises, doing one of those rib cage breaths, I bet you your pelvic floor will start to kick in and work for you. The last thing on our list is just move more. You know, generally, I'd say for a large number of people, the tailbone pain is coming from sitting consistently in one position throughout the day too much or for too long of periods, or standing in one position, or just, again, those muscles pulling at that tailbone in a way that is unbalanced or puts too much pressure in the tailbone area. So moving more, having more variation in our movement throughout the day. If we do work in a standing or sitting position for long stretches, force yourself to come back to some of those exercises that we talked about, whether it's a breath, whether it's pelvic tilts, doing a chest opener on the wall, anything to just have a little more variation in that movement, 30 seconds, and then getting back to work.
Thanks so much for joining us. I hope that was helpful to understand some of the tools that you can use on yourself to help to relieve that tension and pain in that tailbone area. If you have more questions, you want to see more specific exercise routine that you can do, let us know below. Or if there's other pains in your body, we need to know what you want covered so that we know how to help you. So please comment below. Don't forget to subscribe so you don't miss out on future ones.